Hi, this is Dr. Hussein Musa,
Hi, I'm Dr. Adatone Musa.
and this is Healing Talks with the Kingdom Docs.
Today we're going to be talking about gaps in healthcare and how direct care can help.
Yes, last time we spoke about the importance between the transition from pediatric care to adult care and how beneficial having the time in a direct care specialty practice can be for a patient seeking to establish care.
Right. So in the pediatric population, they also suffer from neurological disorders. And sometimes even birth injuries can cause neurological disorders as well. So I do have a lot of experience and a lot of good and bad memories treating patients with Dravet syndrome, Lennox-Gastaut syndrome, cerebral palsy. Not to go into kind of the medical lingo, but all of these disorders have something in common: intellectual disability, cognitive delay, and also sometimes seizures.
I mean, this sounds very complex. I'm a physician. I understood most of what she said, but it just lets you know how vast a knowledge field there is in medicine and how important it is to have a specialist who can treat your specific problems.
Right.
And the time that it takes to develop a specialist, I mean, how long were you in training?
Well, I'd rather not say. It's just going to date me, right?
No, you're like a fine wine. You age well.
Thanks.
Okay, that wasn't a good one, guys. Guys out there, that's not how you compliment your wife.
But just going back to this population, I have the utmost respect, and my heart really goes out to their caregivers because they are typically totally dependent on the caregiver from birth to adulthood. So that caregiver, let's say mom, knows everything about that patient and documents everything in a big binder. This is a typical patient visit with mom and the disabled son. Everything's in the binder. She knows everything about the patient. She also knows everything about their allergies and which medications the patient may or may not tolerate.
Well, one thing I do know is that doctors have a preference in what medications they like to prescribe. They have their own pattern. Now, if you see a new patient, you're going to start your pattern because, yes, we respect each other. There's professional courtesy, but every doctor believes that their way is the best. And, you know, that's what research is for, and that's what evidence-based medicine is for, and that's how you change paradigms. But until they see the evidence, they're going to work with what's worked in the past and what the evidence says. Now, if a patient has a very specific condition, their disease may not have read the textbook. So they may be on a regimen that doesn't make the most sense to you, but the patient may understand completely. And a lot of times as doctors, if you don't have the time to know your patient, it's easy to dismiss what they're telling you as like, oh, they just read this on Google. I know what I'm talking about. I know the side effects of this med, so they might just get ignored.
Right, and you know, a lot of that has to do with the just lack of time to really interact with both the patient and the caregiver. We typically will have 45 to 60 minutes with each patient and caregiver, and then we can really talk to that caregiver about the history, about any sort of adverse effects to probably hundreds of medications. So sometimes it really, the list is lengthy. You need a lot of time. And with my practice, I will be incorporating not just this in-depth conversation with the caregiver, but precision medicine, lab panels, so that we can get to a really good and optimized treatment plan for that patient.
I think that's amazing. And I can only imagine the comfort of mind, the peace, and how much that peace is worth, knowing that you've just transitioned to a doctor who cares, who has the time, and will work with you to develop a treatment plan and partner with you versus dictating the treatment plan and we'll see you in 3 months.
Well, yes, we're trying to fix that, and we will. And I'm so happy that we have the time to do that in the direct care model. Thank you guys so much for joining us.
Visit us at kingdomdocs.com.
Bye-bye.